what is a good strategy that we can practice. So
again, like a deodorant, it's going to help to preventatively absorb the moisture as it comes out.
Today I have with me Dr. Mary Branch, who is a cardiology fellow in North Carolina. She was raised in Ohio and educated in New England. And she has an interest in heart disease in cancer patients, specifically focused on health equity in the field. And to prioritize her own health, she has spent a lot of time understanding how to manage her own beautifully complex roots. And Nidiyah Salahuddin has been in the hair industry for about 10 years. In that time, she's worked with several professional hair care brands in the area of education, product testing, and brand development. And currently, Nidiyah is a stylist and salon co-owner of the Main Loft in Cliffside Park, New Jersey. So welcome, guys. Thanks for coming on.
Thank you for having us.
All right, let's jump right in. So we all know exercise is healthy and we're supposed to be doing it 3 days a week. But, you know, sometimes hair is a limitation. So what are some of the biggest challenges that you see Black women facing with working out and their hair?
I think that's an excellent question, and thank you for asking it. I think for African American women, you know, I can only speak from my experience, but I've talked with lots of friends and colleagues and kind of got a sense of what some of the barriers are for us. And, you know, one thing is we may be very busy at our jobs, and even when we're not at work, we have other responsibilities, either kids, you know, if you're on the PTA, or you're part of committees, or you're helping with your parents, you know, you feel sort of obligated to be constantly working and helping other folks, whether you're getting paid for it or not. And you often may feel a little bit of guilt if you take some time for yourself. And I think, you know, scheduling an exercise may be one of those things that we may not add into our schedule because there's so many things that we're trying to do and accomplish. And then on top of that, you know, beauty and representation is something that we're very in tune to. And so it can be difficult to kind of have our hair straight and together and, you know, it's accepted in the workplace, and, you know, also stay healthy, because it takes, when you're exercising, you're sweating a lot, and that can kind of change the sort of the dynamic of your hair. And so that takes extra planning and time that we often don't have.
So just to tack on to something important that Mary brought up, I find that the biggest issue when I'm speaking with clients in regards to their hair care, and, you know, I want to go to the gym, but you have to go to work afterwards, or they have an event, or whatever the case may be, it's usually the issue of what's presentable in the workplace. So, you know, it wouldn't be such an issue if women could just go to the gym, sweat out their hair, wet it, and wear it curly or natural in its natural state. And a lot of women are doing that now. It's becoming a little bit more popular and acceptable. But I think the bigger issue is the fact that a lot of women don't feel like it's acceptable and don't feel comfortable because they don't want to be subjected to the questioning and the, you know, the curiosity and the, like, you know, unnecessary attention on their hair when they're going to work to focus on other things. So, you know, I think that the reason that it is such an issue is because natural hair still is not accepted as a professional look in the workplace.
No, absolutely. I was even thinking about myself, and I remember when I was really working out the most, I would do it at the end of my day, because I sweat a ton, like literally after in 1 hour, just lifting weights, not even doing cardio, you can wring my hair out. It's so wet. And so doing that, like you said, in the morning and then trying to go to work, basically I'm obligating myself to a ponytail at that point, because there's no way at 6 a.m. you're going to be able to do anything with it. So I guess that's the thing I want to get from you guys. Like, what are some tips that you give women on how to work around that? Because for me, I just decided to work out at the end of the day and then just figure it out at that point. But that doesn't work for everybody. Some people have children, or they have evening obligations, or they work at night, right? And so their schedule is off. So what can you do if you can't put exercise at the end of your day?
So one of the things that I first and foremost tell every client is to push the barrier a little bit, first of all, and just feel comfortable in your natural hair, because realistically, if you want to cut down on your time, you know, something like a twist out or, you know, a natural style with your hair in its natural state versus straightening it is the healthier route for your hair. And there's nothing wrong with it. It's just that we've been put into this box to think that there is something wrong with it. So first and foremost, I always tell women, you know, I'm going to give you some other tips, but understand that this is your hair. It wants to live this way. So the best thing to do is to let it live the way that it wants to live. With that being said, it's not always that easy to just be like, okay, well, I'm going to go for it today. So there's definitely a bunch of tips that I give them on how to maintain like a straighter look while in the gym. I can give you like just a quick kind of overview of what to do. So when you think about the hair getting wet, because that's what happens at the gym, getting wet, and then you need it to be immediately dry and smooth. I always try to give people like the science behind things so that it makes a little bit more sense and you can almost think through it on your own without having to ask me if you're like alone and in a panic. So for me, the science behind it is like, think about when you put your hair on a roller, you want to stretch the hair and smooth it around the roller while it's wet, and then let it dry and cool down before you take it off of the roller. And that's how you're going to mold it into its shape. So when you work out in the gym, it's basically the same principle. You want to set your hair however you want it molded while you're working out and it's getting wet. And then once it's completely dried and cooled down, then you can take out that set, whatever it may be. So the set may be something as simple as a very tight ponytail with maybe like a creaseless band so that you don't get the indentation. But you're essentially using your head as like a roller to hold it firmly against your head. And then once you let it down, your ends are still intact because we're going to tuck those under like a roller. And this is all smooth against your head, also like a roller. So I'm not sure if that makes sense, but basically the principle of wet hair, let it dry and cool down before you take it out of its shape. And then if you need, you can also use a silk scarf to help to maintain and avoid any frizz.
I'll speak on kind of what I've been doing. I don't know if it's the most healthiest. I might be in trouble. But, you know, being in a cardiology fellowship, often we have to be there at 7 a.m. and it's very, very intense. It's mostly men, mostly Caucasian males. And I'm the first actually African-American female in my program.
Wow.
So, you know, the first thing that I had to do, you know, it's hard enough to try to, when you get into an environment, there's a little bit of you that tries to assimilate just so that you're not standing out because you're already standing out by being who you are. And that adds more of a distraction and you're really just trying to learn the craft as opposed to deal with, you know, confusion of being different. So the first thing I did was I just said, you know, I'm just going to need a protective style for like months because I just don't have the time to, you know, exercise, work out, be in this field and then think about, you know, make a strategy for my hair because I knew that I wanted to make a real strategy. I knew I kind of wanted to grow out my relaxer and really just embrace my natural hair. And a lot of that came out of having a daughter and seeing her. And I didn't want to relax her hair. And I said, well, you know, if I'm not going to do it to her, I should start to really appreciate my own hair at this point. So what I've done since I started is done sew-ins for every 3 months. They do say you should give your hair some time to kind of breathe a little bit. But the kind of interruption will add a little bit, you know, confusion. But as I move further and further along and get more and more seniority, I worry about it less and less because I know that my work speaks for itself and I'm at a point where I don't need to have to explain things. And if it's different, I'm just, hey, you know, it's different today. Let's keep it moving. You know who I am. You know why I'm here.
So let's go back to the concept that Nidiyah, you were saying about straightening the hair around the roller or using your head as a roller. Does that work for both natural and relaxed hair? Or are there different tips for natural hair, fully natural versus fully relaxed?
So that's something that would work for natural hair that is straightened. So that's really if you want to maintain straightness. If you are somebody that's embraced the natural curly hair, not straightened out at all, then what I would recommend, it's a little bit easier then, right? Because the only challenge is wetting your hair and cleaning it. So there's different options. Um, if you're working out, let's say you're at the end of your 3 workouts per week, and at this point it's sweaty and gross and you have to wash it. So then I would say go for it, wash it, use your normal products that you're using day to day. The only thing that's a little tricky is a lot of women don't feel comfortable in just what we call a wash and go, which is just wetting your hair and wearing it naturally curly. A lot of women feel like they still need to manipulate the curl into like a twist out or something like that. And that's just not a quick process. So usually if I have someone like that that prefers like a twist out or something that's going to be more time consuming, I would say hold off until the weekend. But if you're going to work throughout the week, you can use things to refresh your hair, like a dry shampoo or a dry conditioner. One of the product lines that we use in the salon is the Amika brand. They actually have, it's very rare to find for some reason, a dry conditioner. For some reason, in my opinion, is I do think that natural hair girls probably seem to find a little bit more value in the dry conditioner. And a lot of times the hair care brands don't realize or acknowledge that, so they end up cutting it out. So basically what the two are is a dry shampoo is going to be used at your root to absorb, it's almost like a deodorant, to absorb the moisture and give you a cleaner feel. It's not actually cleaning your hair. It's almost like what a powder does to sweat, it absorbs. And then the dry conditioner is for your ends that may be a little drier and brittle from maybe the salt content of the sweat or the dryness of the winter air when you're working out. It's just going to re-moisturize and rehydrate your ends. So a lot of people that are not natural don't necessarily need the hydration because their hair is naturally oil. So I think a lot of times companies don't see the value in a dry conditioner and they cut it out, but it is a really, really great and valuable product. So it definitely, if you're wearing your hair curly in its natural state and you need to maintain it throughout the week before you get to the weekend, I would say those are 2 must-haves in your gym bag.
And that goes on after you finish working out, or do you put the dry shampoo on kind of preventatively?
So you can actually do both. Again, like a deodorant, it's going to help to preventatively absorb the moisture as it comes out. But afterwards, the good thing is also the Amika products have a great fragrance. So you're going to get that. They also make a hair perfume. So if you just wanted it for that also, it's great. But I usually do it afterwards to absorb whatever's come out, like the sweat or oils that have come out and that are unwanted and causing heaviness, or even like you don't want odor, obviously, if you're going to work. And then the spray on the ends to re-moisturize and hydrate. If you're someone that's extremely dry, you can even go for an actual oil rather than the condition spray. And then just in reference to a relaxer is a little less challenging just because the hair is already straight chemically. So you won't have to work at fighting the reversion, because that's the real issue with natural hair is we try to fight the reversion. So when it's a relaxer, the kind of roller concept that I mentioned before is perfect, and you should be able to just take your hair down. Maybe use the dry shampoo if it's gotten a little bit too heavy. And you can also use the dry conditioner if maybe like some of the sweat transferred into the ends. So I think for either purpose, it's a little different, but I think both those products are good for both relaxed and natural.
Those are really good tips that I actually had never thought about. And Nidiyah, real quick, does Amika make a dry conditioner, or where can we find a dry conditioner?
Yeah, so Amika is the brand that I use for dry shampoo and dry
For
conditioner.
both. Okay,
Right.
got it. All right. And Dr. Branch, what are some of the tips that you tell your patients? Obviously, you're dealing with the heart and heart health all the time and advising your patients on how to, remain healthy so that they can live, fruitful lives and not be saddled by heart conditions and things like that. So what type of tips are you giving your patients that are coming to you?
Mm-hmm. And that's a great question. I think everything is about strategy and about, the utility of being able to practice the guidelines that are recommended. I think medications do, well. Certainly, they have their mortality benefits, but the best way to prevent disease, to treat disease, is to prevent it. And so I really hone in on the strategies for folks on eating well and exercise. So for us African American women specifically, I talk about, what is a good strategy that we can practice. So I think one thing, and Nidiyah touched on this, is kind of planning your day-to-day style and your weekend style. So if you are planning on your exercise, you say, okay, I'm going to exercise 3 times a week. I'm going to get sweaty 3 times a week. And then maybe do lighter exercises in between. Then on those 3 days, you may do your updo style, your style that's very simple, that will just kind of, you'll be able to set and let it go.
Like my
And that still
ponytail.
looks like a ponytail. Right. And then on your non-exercise days, you can plan it where, okay, now I'm going to, roll or dry it these days. I know not putting a lot of heat on it is important, so really limiting those days where you're putting on lots of heat. And then your weekends, when you're ready to go out and have a good time. I went to an all women's college, so usually the weekend is when we, that's when we really dressed up and did our thing. But during the week is when we were just very focused and we weren't too into what we were looking like. It was really about the what we had to accomplish. So I think that's a good way to coach patients and friends, is really just come up with your strategy, have your days where you're gonna sweat it out and exercise, and just plan it. Kind of have a journal, a diary, and use that as your guide, so you don't have to think too much. The less you have to think each day, the better. So you can just focus on what you need to do. So if you have a plan and you work it out with your stylist, and this is what inspired me, is just talking to different stylists. Shout out to Gia in Durham and Sparkles in Charlotte, who helped me kind of come up with these sort of different tips as well. So it's all about strategy, just kind of coming up with what works for you, and then sort of going from there.
Awesome. And so another question. So, I imagine that Black women that are watching this are starting to think about this. Is this something they should talk to their doctors about? And do you think that Black women are talking to their doctors about this, to say, look, I know you keep telling me to work out, maybe I need to lose 5 pounds, or maybe I need to do it for my heart health. Are they being honest with their doctors?
So I think even as a hairstylist, I do tell my clients often when they come to me with certain things that they have to remember that hair is a byproduct of your body. So you do need to talk to your doctor if you notice something different about your hair, or even if you want hair care tips. I think as a stylist, we have to be aware of the fact that people come in with issues with their hair sometimes, but we can't solve every issue because hair is a part of your body. And sometimes you do need to be referred to a doctor. I never discourage women from working out because they want to preserve their hair. I might, like Dr. Branch mentioned, suggest planning accordingly. But I mentioned to you earlier, Thais, that I have a fiance that owns a gym. So like, I don't tell women not to go to the gym. I understand the value of fitness. So you definitely should make sure that you're working out, but plan accordingly. And you really have to have a relationship with your hairstylist. And if that means setting, maybe 3 appointments in advance so that you know that my month is planned out, then that's what you have to do.
Yes, absolutely. That's good. But I think, I think we are, at least patients that I interact with, I haven't heard anyone ask or sort of talk about hair and the importance of it in terms of being a barrier for exercise. I think it's just one of those things that we all kind of know but don't talk about. And if you have a lot of, especially in cardiology, not a lot of physicians look like them, and so they may feel timid and they just want to say, okay, yes, I'll do all of these things just to kind of get out of the visit, as opposed to the visit really being something where you're really trying to accomplish something. It's just, okay, I'm here because someone told me to be here, and let's kind of get through it. So I think it helps to kind of build that relationship as physicians, and for us to sort of counsel our colleagues about maybe ask a little bit more, dig a little bit deeper about why folks are struggling with weight loss.
I agree. And so one thing Dr. Branch, you mentioned sew-ins really briefly, but we haven't really talked a lot about that as an option or a tip, as well as braids, things like that. All right, pros, cons, is that a solution to folks that are working out? What do you guys think?
I think that it can be a solution. So a lot of women tend to go towards braids when they know that maybe they're on like a weight loss journey right now in life. And so they'll go towards braids because they know they're going to be sweating heavily. I think that's a great option. As long as you're comfortable, again, it goes back to women's level of comfort in the workplace and what they feel like they can and can not get away with wearing. So a lot of women resort to weaves, which is my specialty actually, so I love it. But I still always say that I give women weaves to make them feel good about themselves and to enhance their look. But I want women, Black women specifically, not to forget who they are. And you should still feel comfortable in your own hair. A weave is a good solution as long as you keep in check that this is just something to enhance myself. This is not who I am. So yeah, it helps to protect the hair. A sew-in helps to protect the hair. The main thing is you need to make sure that it's being shampooed correctly, because if the base doesn't get dried completely, then it can have adverse effects, because you don't want to leave wet hair sitting under a weave. So there's, so many different options. There's weaves, there's braids, there's clip-ins. Wigs are a great solution. But then I think that the other issue that kind of comes up is these are really costly options a lot of times. So it's a little frustrating because, you look at your colleagues that can kind of just come to work without spending a dime on their hair if they wanted to. And Black women are investing five, six, depends where you are, hundreds of dollars a month on their hair. And it can be a little frustrating. I understand it. Even as a stylist who's benefiting off of it, I understand that it's frustrating.
I feel like whenever we talk about health, whenever we talk about weight loss journeys, whenever we talk about eating healthy, there's always cost, right? There's food deserts. It costs more money to get fresh foods than it does to go run through the drive-through at a fast food place where everything's two for $1. And it's like now hair too, right? It's like, well, if I want to be able to work out and be healthy, you have to factor that in as well, because maybe you can stretch your hairstyle for a week or 2 weeks if you're not working out. But now that you're working out 3 days a week, now you have to, like you said, plan ahead and have more frequent appointments. So I hadn't really thought about it like that from a cost standpoint too, but it seems to kind of fall in line with all these other things that we have to think about when we're thinking about staying healthy. Dr. Branch, did you have something?
Mm-hmm. No, I think all those points are extremely well taken. One is sort of the weight loss journey. So, there are times where I just said, I really need to lose, after the baby, 30 pounds, 40 pounds. And so definitely a protective style during that period. I still did the sew-in, but, I think braids during that time, you're really just focusing on your weight loss and then maybe going back to your different styles or natural hair when you're done with that sort of journey and you're just doing your kind of maintenance, keeping your weight down, I think is important. But, as I think about it, not to be funny, but, who are we trying to impress, I guess? I think what's most beautiful about us is our confidence and our ability to multitask and be, just talented and, just very well received. And so I think if we focus more on that confidence and about our abilities and our brands, I think it will all come together, and our hair will kind of fall in line with us. But I think we should put our confidence at the forefront. And so, we may spend a little bit less time on it, but I think we'll become more attractive because of that confidence. So, I just think, who am I working so hard to impress? No one. Once I think about that and I think about who's more important, it's me. And so if I'm just having a bad hair day today, I just am. But, one thing I'm going to be doing is taking good care of patients and, being part of my research committees and doing what I need to do. And that confidence is what makes me more attractive. I think I've gotten more attention, from my husband. Now they're more confident. I could do all the styles and different styles of my hair, and I may not get, as much attention. But when I'm really just honed into myself, that's where it comes from. So I think that's where the value we should be putting into our own confidence, as opposed to, but certainly going to see our stylist as well, but just maybe thinking about sort of that cost and that confidence as well, adding that to the value of our appearance.
I think that's a great way to close us out, actually. I love that. And so thank you, both of you guys, for joining me today. Thank you to those at home that are watching. All of the links, resources related to today's topic will be right underneath this video. You guys can check those out. And please subscribe to get more Black America's Health episodes. And you guys have a wonderful day.
Thank you.
Thank you.